Hello everyone, welcome again to my channel. My name is Nurse Ayodele, and if not subscribed yet, kindly subscribe to my channel, share my videos, watch my videos so you can learn from it. Today we'll be talking about a very delicate topic which gets so many people on their toes because they don't really know the reason and why it happens. But today I'm going to be simplifying it, and that is why you need to watch, you need to share it so everybody can have the knowledge. And what is that topic? It is cardiac arrest. Cardiac arrest. You know, cardiac arrest can happen at any time, at anywhere, and when it does, every second counts, and that is why you have to have a knowledge about it. Unlike heart attack, cardiac arrest means the heart suddenly stops beating. The heart suddenly stops beating, and without quick action, that person can go from there. That person can go from there within minutes. Within minutes. So today, let us break down what cardiac arrest is and the different form of cardiac arrest so we can have knowledge about cardiac arrest. Fine. Cardiac arrest happens when the heart's electrical system malfunctions. The heart has got its own electrical system. It's got its own electrical rhythm by which it works by. So when there is an electrical system malfunction, it happens to gadgets. When there is a malfunction, it stops working. And if you don't repair it immediately, that is all for the gadget. That is the way our heart works as well. So instead of pumping blood normally, when there is an electrical system malfunction, it stops pumping immediately. The heart just shuts down immediately and stop pumping blood. That is what cardiac arrest means. So this blood stop flowing to the brain, it stops flowing to the vital organs which cannot survive without blood and oxygen. Most of our organs cannot survive without blood and oxygen. And when the heart is shut down, there is no way to supply them. So this person then collapses, stop breathing, and becomes unresponsive. That is what happens in cardiac arrest. That is what happens in cardiac arrest. People often confuse these two, heart attack and cardiac arrest. So let me differentiate them for you. A cardiac arrest is like an electrical problem. The heart suddenly stops. The heart suddenly stops. While a heart attack can actually lead to cardiac arrest. They are not the same. A heart attack can lead to cardiac arrest. Cardiac arrest is deadly. The survival rate drops about 10% every minute that there is no CPR and there is no defibrillation done. When someone comes down with cardiac arrest and there is nothing done, the probability of that person surviving drops by 10% every minute. Every minute. So immediate action must take place. Like if somebody comes down with a cardiac arrest, immediate action must take place. Either you begin CPR or defibrillation. So what can actually cause this cardiac arrest, or what are the risk factors for cardiac arrest? Come with me, let's go. A cardiac arrest can happen to anyone. It can actually happen to anyone. But people that have a higher risk are those with heart disease. People with heart disease, or those who have had heart attack before. Somebody that has had a heart attack before has a tendency of coming down with a cardiac arrest. Another one is people with abnormal heart rhythms. People with abnormal heart rhythm, probably you've had ECG done, you've had echo done, and you've been told you've got abnormal heart rhythm, you could come down with a cardiac arrest if you are not careful. If you are not careful, you could come down with a cardiac arrest. So people with heart failure, those that have got heart failure can also come down with a cardiac arrest. People with family history of sudden cardiac death, anything related to the heart. If you've got a family history of this, you can also have it. That is why one need to pay attention to their health and family history. You need to know your family history of all of these diseases so that you can know how to take care of yourself. So, people with drug overdose or severe trauma, people that, or if you're a drug user, or probably you happen to take too much of the medications that you are not supposed to take and you come down with an overdose, that could lead to cardiac arrest as well. So, athletes with undiagnosed heart conditions can experience it. People, they do rigorous activities and they've not checked their heart, they've not done any investigation, they can come down with cardiac arrest all of a sudden. All of a sudden can come down with cardiac arrest. So sometimes this cardiac arrest do not give warning. It will not tell you when it's going to happen. You would not know when it's going to happen. But the thing is, it will give you signs. It will give you red flags. It will show the red flags that you will know that something is going to happen. One thing is chest discomfort or palpitations. When you see that your chest feels so tight or you're having palpitation, you can actually hear the way your heart is beating. You can hear the way your heart is pumping. That is a red flag for cardiac arrest. Another one is shortness of breath. You are always having shortness of breath, or probably you collapse suddenly. There are some people that they just collapse suddenly, and it's very often to them. They collapse suddenly with no cause. They don't even know. And when they collapse, you can't feel their pulse. They are not breathing at any time. Those people have a tendency of coming down with a cardiac arrest. So, if somebody drops down unresponsive, the first thing you should think about is cardiac arrest. That person might have had a cardiac arrest, and that is why you need to take action immediately. You need to take action immediately. So what do you need to do? The first thing is to call for help. Dial your emergency number immediately. Whichever emergency number is in your country, dial that number immediately. And when you are while dialing that number, start CPR. You need to learn CPR. You need to learn. This is something everyone needs to learn. You place your hand hard at the center of the chest. You place your hand at the center of the chest and you give about 100 to 120 per minute. You keep 100 to 120 per minute. You need to learn it. I think it's something everyone needs to learn because you can't tell when this is going to happen. Another thing you need to do is if there's a defibrillator and there is somebody trained to use it, let that person use it immediately. Don't forget you already called for help. So whatever it is you can do before that help comes, keep doing it and do not stop until that help arrives. Do not stop the CPR if that is what you're doing, defibrillation if that is what you're doing, until that help comes. Because every minute counts in cardiac arrest. Every minute counts in cardiac arrest, and your action can double or even triple the chance of survival. So that is it for cardiac arrest. It is a sudden, deadly thing that if you have a knowledge about it, can save a life. It can save a life. So my challenge for you today is go and learn CPR, because you can never tell whose life you will need to save. So learn CPR, learn it. There's a difference, there's a thin line between life and death. So thank you for watching. If this video has helped you, if this video has helped, like it, share it, subscribe to my channel for much more videos like this. Bye. Thank